Hi, my name is Danniyal Shahid. I'm a podiatrist, foot and ankle surgeon here at Adena Health. I was influenced with a lot of doctors in my family. Growing up with doctors, I knew since a very young age that I wanted to be in medicine. My father was an anesthesiologist. He's still practicing. So I was exposed to the operating room at a younger age. And just being in the OR, being in an environment, I felt like I could make more of an impact as a career. And eventually, when it came time to choose a specialty, I wanted to choose a specialty in which I have a balanced clinic life, I have a balanced surgical life. I was practicing, I was in private practice prior to coming to Adena Health. One of my good friends and colleague was practicing here. He introduced me to the system, and after listening to him, coming over here, doing a formal interview, looking at the place, looking at the community, the camaraderie between the department, the interdepartmental camaraderie that we have. I think Adena being a smaller setup with all the bells and whistles that are available in a bigger setup make this a much more patient-centered place for effective care. It's big enough where you can have access to every advancement in healthcare, but it's small enough that you will get the attention of the doctor and the staff at a personal level. You're just not a number for us. The most important thing patients can expect from me as their physician is that I'll be honest with them, I'll be upfront with them, I will treat them no different than I would treat my own family member. We see foot and ankle problems, but many times the foot and ankle problems that we see localized are stemming from somewhere else. For example, we'll have patients with chronic diabetes or chronic arterial issues with localized symptoms in the foot, right? So we'll have to see them, treat them holistically as a whole to treat the main problem the patient is there for. Many times when we come in contact with the patients, it's a very stressful situation for the patients. It's sometimes a limb-threatening, sometimes it's a life-threatening situation. At that time, when we are able to take care of the patient, right, it leaves a lasting impact, because many times these injuries, these medical emergency situations that we're dealing with are life-altering, and they remember those events. So giving them the care and the empathy that they need at that time will leave a lasting impact not only on them but also on the community. I like to enjoy time with my family. I have a very happy family life. I have my wonderful daughter, she's 6 years old. I enjoy spending time with her. I love to travel. I travel the world quite frequently, as much time as I can get. I'm a big history buff. So if you ever want to have a conversation about that, I'm more than happy to entertain that. Many times we'll have patients who will come in with an emergent situation that we see sometimes in the clinic that the patient doesn't realize is an emergency. We can admit them to the hospital very smoothly, effectively, and have a very effective team effort, patient-centered effort to take care of the patient in that situation that they're in.